Hi, good morning. How are you? My name is Ren. I'm your occupational therapist. How are you doing today?
Good, how are you?
Good. Do you mind just confirming your name and your date of birth for me, please?
Sure. Van 1030 59.
1959. Very good. Hi, Van. Can I call you Van?
Yeah.
Okay, great. So, I recently read in your chart that you just had surgery in your chest. How are you feeling? Do you have any pain right now? Did you take any medication?
I think I took medication like at 6 o'clock.
In the morning?
Yeah.
And did you have any, are you having any pain right now?
Just a slight pain, like maybe a 3.
3 out of 10?
Yeah.
With 10 being the worst?
Yes.
Okay, that's good. Are you comfortable with continuing your rehab?
Yeah.
A slight pain? Okay. So if it gets any worse, we can go ahead and contact your nurse and see if we can do anything, or we can just take a break and we'll see where we'll go from there. Okay? Alright, so what we're going to do today is I'm going to show you how to get out of bed, and I'm sure you're very willing to get out of bed. You're thrilled to get out of bed. You've been in there for a couple of days. So I'm going to show you how to get from lying down to your side. The next thing I'm going to show you is from your side to sitting on the edge of the bed. And from the edge of the bed, I'm going to show you how to stand and sit on a chair. Okay? And after that, we're going to do some upper body dressing with a shirt. So, you had your surgery. Do you remember the sternal precautions that your doctor told you?
He went over them, but I don't remember.
Don't remember them. That's okay, because there's quite a few of them, so it's very normal not to remember all of them all at once. We'll go over them throughout the session, and then we'll have a paper or a handout for you with all of your precautions and everything you need to know or to be aware of throughout your stay here and when you go home. Okay, so, well, for these precautions, you're going to have to consider them for the next 6 to 12 weeks, or until your doctor tells you otherwise. So the first one would be no rapid upper extremity movements, so that's no rapid movements of your arms. No lifting or pulling more than 5 pounds. If you can imagine, 5 pounds is like half a gallon of milk. So if you're going to go to the grocery store and buy a whole gallon, have someone else pick it up for you. We're not carrying more than half a gallon of milk. Another one would be no pulling, no pushing with your arms. So that includes, right now, we're going to consider that when we're going up out of bed. So we're not going to push ourselves with our arms. And to avoid that, I'm actually going to give you a pillow right here. And throughout this whole session, can you lay right there? You're going to cross your arms over your chest. And to remind you to keep your arms crossed, I'm going to have a pillow over you. Okay, can I place this pillow over you? Just right there. And then just hug it like you're about to go to sleep. Okay, let's do a crisscross. There you go. So additional precautions would include avoiding any upper extremity shoulder flexion, which is bending, which is pulling your arm up. When we're past this midline, that's 90 degrees. You don't want to go over at all. Another movement would be the same movement but to your side, so kind of like flapping your wings. Okay, you don't want to do that. That's all for precautions to avoid anything affecting your sutures. Okay. All right. So additional precautions, you would have minimizing upper extremity weight bearing, but we'll go through that maybe later in rehab if we have to use any canes or if you're holding on to anything. No excessive twisting, so none of this. Using a pillow when coughing, that's really important. If you're coughing, you're applying pressure outside of your body, so the pillow kind of stabilizes it. So if you're hugging it and you're coughing out, it kind of holds your chest in, okay? And no driving until your surgeon says so. Okay, we'll go over these again later, and again you'll have a handout, so you don't have to worry about memorizing all of them. But big ones are no pushing, no pulling, no lifting more than how many pounds? 5 pounds, which is equivalent to
Half a gallon.
of milk.
No.
Very good. And no rapid movement. So of course, just be careful with all your movements to the upper extremity and don't reach up too high. Okay. All right, Van. So we're gonna do a log roll. Oh. All right, Van. I'm gonna go wash my hands really quick. All right. So let me take your vitals really quick. So I'm gonna do your oxygen, your heart rate, your temperature, your respiratory rate, and your other vital. Okay. It all looks good. Wait. We're gonna. So next, what we're gonna do now, I'm gonna have you roll over to your side. That's gonna be our first movement to get out of bed. You ready for that? Okay. Do you mind if I place my hand on your hip and your shoulder? Okay. Do you mind bending your knees really quick? Both knees. Very good. I'm gonna reach over. And then in one swift movement, I'm gonna have you turn to your side, okay? 1, 2, 3. Go ahead and turn back. And do you mind moving a little that way to the side with your, there you go, very good. Okay, try that one more time. 1, 2, 3. Okay, then, that's one movement. Again, keep your hand crossed. And try to avoid any pushing from this, okay? Now we're gonna go from lying on our side and sitting on the chair. And sitting at the edge of the bed. Okay, then, go ahead and I'm gonna have you kick your feet off the bed. And I'm gonna assist you with this. Your only job is to hug this pillow. And you don't push with your elbow, okay? I'm gonna place my hand on your hip and under. Okay, oh, careful. Alright. 1 second. You saw how you lifted yourself there? We don't want that to happen, okay? So I'm gonna lift you up. There you go. On the count of 3, we're gonna swiftly turn in one movement. 1, 2, 3. How are we feeling? Good? Okay. Very good. Let me take your vitals really quick. So your vitals look okay. You feel any dizziness? Okay, good. Do you remember some of the precautions I taught you?
No lifting over 5 pounds, that's half a gallon of milk. No reaching above 90 degrees. No excessive lifting. And no driving until cleared.
Until cleared. Very good. Okay. You got 1/3 down. Alright. Mind scooting a little forward for me? Okay. There you go. You put the gait belt on you. Is that comfortable? Okay. So I'm gonna have you stand up. Primary precaution for this is just avoid pushing yourself up from the bed. So that's why we have this pillow. Anytime you stand up, just to get yourself used to it, try to have the pillow most of the time. So I'm gonna have you lean forward. Before you do it, I'm just gonna explain it really quick. I'm gonna have you lean forward. Your nose are gonna be over your toes. You're gonna push up with your legs, okay? But I'll be here to guide you, so you don't have to worry about anything. Okay, slowly lean forward and push up with your legs. Right, stay right there. How do you feel? Any dizziness?
No.
Okay, good. So let's walk over to the chair. And then let me know when you feel the chair behind you.
Yep, when you stand up.
So when you sit down, you might wanna hold back. Keep hugging the pillow, okay? When you feel the chair behind you, you can slowly sit down, lean forward. When you do, nose over toes again. Slowly squat to sit. Very good. How do you feel? Let me take the pillow for you. So we got one part down. How do you feel about that? Good? Okay. So I know you've been in a hospital gown and you probably want to wear your clothes. Okay, I'm going to teach you how to put on your upper body garments. This is really important because we're trying to avoid all those sudden movements that we talked about in your precautions. Do you mind if I take your sweater? There you go. So I'm going to have you Just copy me. Face your sweater out, with the front facing out. Very good. And then lay the front over your lap. Okay. Grab this. Okay, good. Alright, so when we put our sweater overhead, we would normally just put our arms in, right? Put it over our head. We have to keep in mind, we have to minimize movements of our arm. By doing that, we want to tuck in our elbow near our torso as much as we can. We have a little movement, but yeah, just tuck it into your side. Okay, so with that in mind, hold the front end or the back, the bottom of the sweater. Now so you can go ahead and crumple it up towards you until you get to the neck. There you go, as so. So your fingers are going to be where your forefingers are going to be where your neck are, your thumb's going to be inside. Very good. And then I'll show you really quick how to put it on before you do it, okay? So you can do your elbows on your side, minimal movement. Tuck your chin down. And then you can even move forward if it helps. And then put it on. Okay? Alright. Let's try that. So tuck your chin down. Put it on. There you go. How does that feel? Not too. How's the difficulty level?
Maybe like a 3.
A 3? Okay. So you want to adjust a bit. So keep your elbows in. You can reach across. Just pull the shoulder down a bit with the opposite arm. You can do the same. It's kind of like hugging yourself again. Just pulling the sides down. Very good. Okay, now put your hand inside, but before you do that, let me show you the movement. So you're going to put your arm in the sleeve, but you're going to kind of punch down, okay? So you want to avoid that 90-degree, passing that midline. So go ahead, and then kind of punch down. Got it? Okay, and then the other arm.
You can do it like that, just make sure your elbows don't go up. So keep it like that.
Very good.
And you can also lean forward and tuck your chin into it.
Awesome. Okay, so now we have this kind of like awkward part in the back, right? It's kind of up, so you want to pull it down. Again, we're going to do a lot of hugging ourselves. So try to reach for it and try to pin it down, pull it down. How are you doing? It's good. It's all the way down. And then if you have someone with you, do you have someone at home who can assist you? Okay. So you can have them do final touches. Just have them fix in the chest. And there you go. How was that?
It's a little hard.
It's a little hard. Okay, so we can practice a couple more times today, and then we'll keep doing it throughout the week and see where we are and what our difficulty is. Okay, so next I'm going to show you how to take it off. It's kind of like the same way. It's the same techniques. So we're gonna same arm, same side of the neck. Keep in mind your shoulders movement and keeping your elbows tucked in. What we did earlier, we're gonna crumple up the shirt from the back. Okay. I can assist here. There you go. Alright, so yeah, chin tucked down, go ahead, pull it over, very good. Let's fix your hair. And then with the opposite arm, you can just pull the sleeves off. Now slowly and gently. Did you feel any pain at all during that time? No? Okay, that's better. And there you go. How are you doing?
Good.
Good? Okay, so we can try with other garments, with other types of sweaters that you have. Every time we have our sessions. We'll practice this again and again until we get used to it. And then I have this handout here for you. You can reread it. Try to familiarize yourself with the precautions because that's really, really important. And And I think that's all. Do you have any questions? Okay, let me take your vitals really quick before I head out. You look great. Okay? And we'll see you tomorrow.